Hello, I'm Dr. Stephen Castor. I'm the Chief Medical Officer at Menorah Medical Center, and welcome to today's edition of House Calls, where we take the time to interview thought leaders at Menorah Medical Center about subjects that are interesting and important for our community. Today we have with us Dr. Ben Mizrahi. He's a world-renowned colorectal surgeon that we have at Menorah, and we're going to be asking him some questions focused around colon cancer and screening and treatment. Welcome, Dr. Mizrahi. Thanks for joining us today.
Great, thank you.
You are a master surgeon, and I also note that Menorah is a center of excellence for colorectal. Can you describe what those mean to you and to the Menorah and to patients who would be seeking care here?
Yeah, so we're very fortunate here at Menorah. We got designated as a center of excellence in robotic colorectal surgery in 2018, and we had to go through a stringent criteria and evaluation. Basically, it's all based on cases that we do in a minimally invasive fashion using robotic surgery. And what that means for patients is that they get the best and latest care of the treatment of colorectal cancer and disease process.
Great. So, colon cancer screening has been around for a long time. Recently, the ages have changed as far as when people should get screened. Can you describe what the latest recommendations are for patients and perhaps a history of why the age changed as far as younger people getting colon cancer?
Yeah, this is really, really important because colorectal cancer is the second leading cancer. However, as of recent, in terms of cancer death, it is escalated, especially in the young population. So as we all know, it used to be 50. And then unfortunately, it's not, people have that in their head that, hey, I'm okay until I'm 50, but that's not really the case. If you're not having problems, it used to be 50, and it's screening. But now, what we saw is the younger population, there is an increase in cancer diagnosis, and more importantly, cancer deaths, especially men. So it's very, very important that we do abide by this new screening criteria. But by all means, just because it says 45, if you're having issues, you really, really should take them seriously. Listen to your body, because colorectal cancer is curable, especially if caught early. So it is important to abide by criteria and symptoms.
So there are a lot of different ways to screen for colon cancer nowadays. There's home testing, colonoscopy. Can you describe your approach of what you recommend for patients when they're considering different screening options?
Sure, and really it comes down to invasiveness, right? So screening is that you want to try to catch people early on. There's blood tests, there's genetic testing, Cologuard, that's a home kit. I would tell you that is probably for the really healthy individual that might have vague symptoms. I would start with that, but really there is nothing that substitutes for a colonoscopy. It is the gold standard. If you're having symptoms, if there's question or you want to screen for colorectal cancer, I think a colonoscopy is the answer. The hardest part is the prep. The day before you have to clean out the colon. But then, in my opinion, the next day you take the best nap of your life. It's a 30-minute procedure. And really, you've done probably the best thing for your health. You've checked to make sure that you don't have cancer, or if you have an early polyp or an early cancer, it could be curable at that time.
So there's a lot of viewers that probably have some type of family history of colon cancer. Can you describe how the screening might be different for those with a family history?
Yeah, so family history is very important. And what we see today, there's a lot of what we call healthy people without family history. But if you have family history, usually the recommendation is the colonoscopy should be done 10 years prior to the age of your earliest relative. So in other words, if you have a father that was diagnosed at 45, you should probably have your first screening colonoscopy at 35. But family history is very important, but that's not the only factor. You should definitely consider symptoms as well as family history.
So if a patient has colon cancer that requires surgery, can you describe the process of robotic surgery that's used here at Menorah to take care of that problem?
Yeah, and again, this is what we do a lot here. We're leaders in robotic colorectal surgery, and we have the latest and greatest technology. So it used to be that when you had colon cancer, you used to have a big incision, potentially a colostomy or what people call it as a bag, and recovery was anywhere from a week to 10 days in the hospital. But now, we do it in a minimally invasive fashion using the robot. You're able to see better, you're able to avoid complications, and you're able to, more importantly, especially with rectal cancer, low-lying rectal cancers, you're able to avoid a permanent colostomy or a bag. And really, recovery is phenomenal. It's not unheard of that the patients go home the next day or the following day after surgery.
Very good. Any other issues that we haven't talked about that you'd like to let our viewers know about related to colon cancer or colon screening?
I think it's a topic that not a lot of people want to talk about. For me, it's dinner conversation, I'll be honest. But it's really, really important because it is one of the very few cancers that is truly, truly curable. And if caught early, you can either avoid it altogether or you can cure the disease. So really, if there's any problems, listen to your body and go see your doctor, and if need be, get a screening colonoscopy.
Very good. Well, thank you, Dr. Mizrahi, for visiting with us today. And if you'd like to learn more about colorectal cancer, colon screening, or our colorectal program here at Menorah, please visit our website at menoramedicalcenter.com. Thank you for joining us.